Hi everyone. Well, another week's gone by and we've all become a little bit more familiar with this horrible coronavirus. Despite this, I think we were still all rather shocked by the sudden admission of Boris Johnson into hospital earlier this week. But this has served to remind us of the serious impact that this nasty virus can have on some people. There's so much in the news at the moment about the virus, but this week we had a great opportunity to showcase the work of our incredible intensive care teams. Hopefully many of you were able to see the Royal Bournemouth team in action when a film crew from ITV visited us earlier in the week. The film gave all viewers a great insight into the work of a range of staff that we didn't normally get to see, and showed how our hospitals are coping and preparing for this surge in coronavirus patients. And wasn't it wonderful to see the coverage of Linda New, the patient who got clapped out of the intensive care facility by the staff who'd been looking after her? And of course we know that many patients are getting better and are ultimately being discharged from our hospitals. Well, I too wanted to see how people were getting along with their preparations, and this week I've been privileged to go in and meet people both in the Royal Bournemouth and in Poole to thank our teams in person for all that they're doing. Clearly these are some of the most specialist areas, and the staff are well used to dealing with very sick patients. As such, their work is always very intense. But at the moment, having to do this in so much personal protective equipment, seeing what they're doing in the environment in which they're having to provide it is really humbling. We are so impressed by the dedication and courage and commitment of these people. But the trusts really are now well prepared for this surge. We've completely repurposed our hospitals in a number of ways. We've separated out COVID and non-COVID areas. We've expanded our critical care capacity really significantly. We've developed new pathways and protocols and undertaken a massive staff training programme. Very importantly, we've started staff testing this week as well, so we can get our staff back into work really quickly when they're well enough to do so. We've also started a new campaign talking about the support for people, and I would encourage you to look out for this on the intranet. Our OD teams have been working very hard behind the scenes to pull all this together, so do look out for details on posters, via social media channels. We absolutely must support each other. So we're in a good place at the moment. We've got more beds available than any other time in the history of our organisations, and we're in a position to further increase our critical care capacity as and when this is required. Indeed, we're still working on how we might increase it further, should this be needed. So I'm confident that we've done absolutely everything possible to step up to this challenge, and that whatever happens, our staff will do the very best they can for each patient. So, looking ahead to the Easter weekend, the Chief Medical Officer has been really clear that the public's got a huge part to play by staying in and minimising the spread of this virus. And of course that includes all of us too. We really do need to play our part in stopping the spread of this infection and reducing demand on NHS services. In closing, I'd like to take this opportunity once again to thank you for all that you've done over the past few weeks and for all that you're still doing to prepare for this surge. I'd also like to pass on the thanks of our two trust boards and our two sets of governors. They particularly asked me to let you know how very much they appreciate your dedication and commitment. Very finally, I'd like to take this opportunity to wish you a very happy Easter. I hope that everyone gets some downtime over the next few days, and in doing so, take good care, go steady with the chocolate, and most importantly, stay safe. Thank you.